Diabetes mellitus is a metabolic disorder surrounding the production of insulin in the body. And insulin is a hormone secreted in our pancreas, which stimulates our cells to take in sugar to use for energy. And it also helps metabolize nutrients in our body like proteins and other carbohydrates and lipids. There's two types of diabetes. Type 1, which is surrounding the autoimmune destruction of beta cells in your pancreas, thus blocking the insulin, or also known as insulin resistance. Whereas type 2 is more so focused on the body not producing enough insulin, and so as a result, overproducing insulin, thus impacting how our body metabolizes our nutrients.
So as far as symptoms, type 1 and type 2 have similar symptoms. Type 1 is more for childhood, teenage years, and those symptoms appear a lot more quickly than type 2, which is more common in 40 and plus. So those symptoms include like nausea, frequent urination, excessive hunger and thirst, tingling in the extremities, and then fatigue as well. So these risk factors are very common, but they're also very common in other diseases as well, which is why it is very common for diabetes to be misdiagnosed as other things like anxiety and depression, sometimes even Crohn's disease and something like that. So we do have the risk factors listed as well, which Allison is going to talk about.
Yes. So some of the risk factors can include being pre-diabetic, overweight, not getting enough exercise, or not having a healthy diet. And also, unfortunately, being African American, American Indian, Asian American, and Hispanic can lead to a higher risk of getting diabetes.
There are several treatments for diabetes, and for both types, it's mainly important to make sure you maintain a healthy lifestyle and healthy eating habits. One form of medical treatment is insulin, and people with type 1 diabetes actually need insulin to survive. For people with type 2 diabetes, it is helpful for them to make sure that their pancreas are regulated, and we actually have an example of the insulin right here. Your provider will prescribe the best insulin based on what type of diabetes that you have, and it can be inserted several different ways, whether it's through a syringe, an insulin pen, an insulin pump, a glucose monitor, a tubeless pump, or an artificial pancreas. And people with type 1 diabetes actually can have a transplant, and if it's successful, they will no longer need insulin therapy anymore. As a group, we want to promote healthy lifestyles and healthy eating habits at Spelman by whether it's presenting at more fairs like this one, or sending mass emails, or just making sure that the Spelman community is aware of diabetes and just making sure they can maintain a healthy lifestyle. We also want to make sure that the AUC maintains a healthy lifestyle by hopefully being able to be sponsored to host semi-annual glucose testing events where students, faculty, and staff can get glucose tested, and just make sure that they aren't diabetic, and if they are, they can take further steps with their healthcare provider.
Similar to what Allison was saying earlier, the black community is at a higher risk of obtaining diabetes in comparison to the white community. In fact, the black community is 60% times more likely to have complications regarding diabetes. So through our Healthy People 2030 research, we were able to find some significant contributors that affect diabetes, especially in the black community. One of them being education, and the second being healthcare access. So we found that through proper education, health literacy is improved. The percentage of people that are diagnosed with the condition regarding diabetes and pre-diabetes is addressed, along with possible symptoms and risk factors that patients are informed of. And also the death rate of people with diabetes is reduced through this process. Furthermore, we also have healthcare access, which helps with increased screening, which obviously lets people know their glucose levels and anything else that they're affected with. Also, it improves the quality of diabetes care and patient treatment that they receive. With our pre-assessment, even though it's not really super individual and specific, we did ask people to write down their stereotypes about diabetes that they know, anything they know about the disease, just to show the information they didn't know before our presentation. And afterwards, we did have a post-test. It was a short questionnaire with a little snack incentive at the end, a healthy snack incentive that helped. Yes, this is the quiz, it's really short Google form. And we also did some pins as well because it is Diabetes Awareness Month.